My name is Dr. Navneet Tewatia, and I'm representing Medicines Patent Pool. I thank the organizers of today's event, International AIDS Society, Zindagi, and the Aga Khan Foundation. I'm very happy that I'm able to join you virtually for this meeting. I'm going to talk about the long-acting injectables in Pakistan and also introduce my organization. So Medicines Patent Pool is a public health organization, and our mission is to increase equitable access to innovative medicines. And we do it through voluntary licensing and through technology transfer. We are funded by UNITAID and also by the governments of France, Germany, Switzerland, and Japan. We have a very simple model which we practice. We always identify for medicines and other health technologies which are much needed in low and middle income countries. So these are primarily the essential medicines recommended by WHO. And when we know these medicines, we approach the innovators, the patent holders of these medicines, so that we can start the negotiations. And once the negotiation process is over, we sub-license these products to the generic manufacturers, which can supply to low and middle income countries. And by doing this, we work with the manufacturers so that we can accelerate the development, the in-country registration, adaptation of formulations for LMICs. And by doing that, we collaborate with various partners so that we can increase access to these LMICs. So by doing this, we work with various stakeholders, but our guiding principle remains that we are public health driven, we are flexible, we collaborate with multiple stakeholders. Our focus remains on improving and accelerating access. We facilitate innovation wherever it is needed. We complement the other mechanisms of access. Our licenses are non-exclusive, voluntary, and very much transparent. So by doing this, we benefit all the stakeholders. So actually we create a win-win situation for the patent holders, for the generic manufacturers, for governments, and most importantly the communities. Because the innovators, they are able to improve access and penetrate in the territories where they are not present. It definitely improves their reputation. There are some royalties wherever applicable they're given. The generic manufacturers, they accelerate the accelerated approach to the development of affordable versions of these health technologies wherever needed. That opportunity is created, and wherever there is need for new fixed dose combinations, there is a possibility of innovation for them. But by doing that, governments benefit a lot because the prices of drugs are much lower, the quality is ensured because our products are all WHO pre-qualified. So more number of people can be treated with the same amount of money by this. But ultimately the beneficiaries, the communities, they have greater access to these quality life-saving drugs. So our scope of work, as you can see here, we were founded in 2010. We started with HIV focus, but in 2015 we broadened to include hepatitis C and tuberculosis. In 2018, essential medicines from non-communicable diseases, they were included. 2020, when COVID came, we expanded to include COVID. And in 2021, biotherapeutics, that became part of our scope. Within the COVID pandemic in 2021, we started the mRNA vaccine program with WHO. You can see that in these 14-15 years, we have established a huge manufacturing base in all across the region. So you can see majorly in the global south presence. So now we are present in 14 countries through our manufacturing partners. We have almost 58 generic manufacturers across these countries, and Pakistan is also one of our partner countries through Remington, the pharmaceutical company. So we have signed licenses with 18 innovators in all these therapeutic areas. the disease areas where we focus on. This slide gives you a snapshot of the licenses and sub-licensing agreements which are available for Pakistan. So in almost all the areas, Pakistan is included in all our licenses. So just to give you an idea, for HIV, dolutegravir and TLD, and for hepatitis, daclatasvir, we manufacturing partner Remington is there. For GP and for molnupiravir and nirmatrelvir for COVID. Pakistan is part of the mRNA technology transfer program and also is very much party to it. This is just to show that out of 15 countries, Pakistan is one of them. In our 15, I'll just give you a case of dolutegravir and TLD. In 2013, when it was the dolutegravir was approved by US FDA, we had started our work to have licensing agreement. So in 2016, when WHO recommended this as a first-line drug, we were working with the generic manufacturers and with the innovator to have this drug available. You can see that in case of tenofovir, it took very long, almost 10 to 11 years to reach to a stage where the upscale for LMIs can be done. But in case of dolutegravir, within 5 years or even less than that, the drug was available. And today, we are able to reach out a large number of population accessing this drug. This could be possible because we were there early licensing. We had in-country registration support. We had national guidelines and WHO recommending this drug. We had early market signals and forecasting, showing that there is huge demand that's going to be there. And the voices of community were very strong, and that helped a lot. And along with the market shaping by our key funders. So by doing that, we have acknowledgement from Access to Medicine Foundation, through the index that MPP licenses are, providing highest level of flexibility and a huge broadened geographical scope. Our impact, this is very important, that whatever we have done till now, what impact it has created. So we are able to reach out to 148 countries and supplying almost 34.7 billion doses of treatment, a huge cost saving for countries and procurement agencies. So it's very satisfying that we are able to make our mark, and since our mission is improving access, we're working towards that. So coming to today's topic for long-acting injectables, we have these 4 different technologies in long-acting therapeutics. 3 of them, they are under development. Only cabotegravir long-acting injection, that is under development stage, which in the product development stage. So I'll show you where we are. So as you know, the CAB-LA is one of the HIV prevention options, which is recommended by WHO, which is effective, safe, well tolerated. It's once in a 2 months injection, and it's along with other prevention strategies like oral PrEP and the vaginal rape. So MPP and ViiV, they got into a license for PrEP early last year in March, and through this we have a manufacturing license with 3 manufacturers which are developing and which will be supplying the generic version of PrEP. Similar to the case of dolutegravir, the licenses territory will be all covered, the product will be WHO pre-qualified, and because this is a long-acting injection, so there is a huge support provided by ViiV through MPP by transfer of technology and know-how. So as I mentioned, that the territory which is included in the license will be supplied to. So all the low-income countries all the low and middle income countries, sub-Saharan African countries, and least developed countries, they all are included. And the places where the patent is not there, the supplies would be possible in those territories as well, including Pakistan. So I'm very happy that the countries which are included, they'll be able to take full benefit of such innovative drugs through generics. So Cabotegravir in 2022, when it was FDA approved, soon after, NPP site license, just as to show you the timeline. And right now the product is under development. NPP facilitated the technology transfer agreement with ViiV and that has been completed. So right now it's into the development stage. So maybe in next 2 years the product will be available, and these timelines are indicative not only for one manufacturers but an average, just to give you an idea that when this product may be available. And I would like to sum up here and by concluding that Pakistan is included in majority of our NPP voluntary licenses, and it's very important for countries to be included, because only then they can take the full benefit of these innovative products which are high quality, which are WHO recommended, as well as WHO pre-qualified. So a product like PrEP, long-acting PrEP, can be game changer to prevent new HIV infections, especially in the key populations. So for this, we need to have advocacy for regulatory approval, for in-country adoption, inclusion in the PrEP guidelines. We need to strengthen the community education, which is very critical to raise awareness about these prevention strategies, about these new prevention tools. And for this, collaboration is needed to create advocacy strategies, and we need to continue to integrate with civil society, because when civil society demands, the things really work. So I conclude here. I would again like to thank the organizers and my organization, Medicines Patent Pool, for giving me this opportunity to present before you. I'll be very happy to answer any questions. The slides will be shared, and I'll be happy to respond to that. Thank you very much, and have a good day.